We're going to go ahead and get started. Good afternoon, everyone. Welcome to the San Mateo County Dental Society's webinar. My name is Jim Icardi. I'm the operations specialist with SMCDS. Before we get started, I want to review how we'll be running this meeting. All participants will be placed on mute during the presentation. You may post a question into the Q&A box. I'll now introduce our presenter. It's Nicole Yount. She's an orthodontic practice consultant. Nicole brings a unique blend of clinical and administrative expertise, specializing in clear aligner therapy, practice optimization, team development, and strategic planning to empower doctors and teams to achieve their goals. Welcome, Nicole. Excited to have you.
Thanks, Jim. Happy to be here. Appreciate the intro. All right. Well, we're going to jump right in. Appreciate you all spending your lunch hour with us. I'm excited to dive into some content with you and hope you get some pearls out of this. And Jim, if you can just interrupt me if there's any technical issues with the slides, because I will not be able to see you now, that would be great. All right. So again, welcome to this afternoon's webinar. Again, appreciate you taking the time out of your day to be with us. And we're going to talk about clear aligners today and clear aligner therapy. So something I like to call straight talk. Typically we go over the 5 things not to do or to avoid when implementing clear aligner therapy into the practice. And I want to take a little spin on that and talk about the top 5 things I think you must do when implementing clear aligners. So again, welcome. All right. So a little bit about me. So I live in Seattle, Washington. I have 4 children and 2 fur kids. I have an English cream golden retriever who's not pictured there. She is about 9 months old now, so she'll make the family photos this year. But I've got a sophomore in college, a senior in high school, and my 2 twin boys just started kindergarten. So I always say it's controlled and unorganized chaos at times at my house, but it's a fun journey. So on the professional side, so I'm a former orthodontic treatment coordinator for a top-tiered multi-location practice, and I was with that practice for about 10 years, which was an amazing, wonderful experience. Not only was I a treatment coordinator, I did everything from assisting to insurance billing, pretty much anything you can think of aside from being the doctor diagnosing. I loved it. I learned a lot. So no stranger to clear aligner therapy. I've been selling it and treating it for over a decade. On top of that, I'm a former Invisalign and iTero territory manager and field sales trainer, and was with that company for about 5 years, and made the switch to consulting and came on with Next Level Consultants because I realized that while I was in and I was selling clear aligners and scanners and talking to it, I really missed diving in and rolling up my sleeves with teams in a more comprehensive way, right? So as a territory manager, you're only able to do that for so long, given the amount of accounts you are to touch each day and to go in and see. So being on the consulting side of it, I'm really able to come in and again provide more of a comprehensive approach to my doctors and teams. And ultimately the goal is to create a consistent orthodontic program. And in order to do so, you need systems. So that's really where my passion lies now. And I'm just excited to again be reaching doctors and helping them on a national level. So I'm going to start off with a little story. So, a little orthodontic fairy tale. So, this is 8-year-old me. So, again, I am no stranger to orthodontics for obvious reasons. If you've seen a ortho chart note, or depending how you chart, it's just a little funny I'm giving you. But patient age, I was 8 years old, and chief concerns, I really don't see much other than the haircut that my mom thought was appropriate. But my ortho diagnosis was I was a class 2 mild moderate spacing and severe overbite, moderate overjet. So my treatment objectives, I remember sitting in the chair and my mother saying that she wanted her daughter to be able to close her lips over her Bucky Beaver teeth. So as you can assume, at 8 years old, that was absolutely mortifying, and I've never forgotten it. But ultimately, I was in treatment for about 5 years, went through the ortho gauntlet of expansion, headgear, elastics, more elastics, and of course, through retainers later, relapsed and went into ortho and clear aligners as an adult. So, again, no stranger to the ortho world, and having gone through it myself. So, all right. So, the top five must do's in the practice. So, again, I want to cover these five things that I believe and find are really imperative when we are trying to implement a clear aligner product and service offering. If you have a lack in any of these, or we're really good at one bucket, I tend to see where it just falls flat and that we don't get a ton of pull through, or we do really great. We have this crazy case explosion where we're doing 10 cases, let's say, and then the next month or the next 6 months, we dwindle down to two. And typically I find that it's a lack of one of these five things that's not been really honed in on and trained to. So the first is case selection and identification. So my doctor is having the clinical confidence, obviously, to treat certain cases. I'm going to talk about what I believe is a slam dunk case in a GP office and what to avoid. But I also think case selection identification, it goes back to your staff as well. Your staff needs to be able, everyone from assistant to hygienist, needs to be able to identify who a good candidate might be for clear aligner therapy. We're going to talk a lot about team training. If you don't have a team behind you, you're nothing. You got nothing at that point. So I think I see and have seen over the years where I have a doctor go to a course, right? Because as a GP, you get a very small curriculum on orthodontic training in school. So I often find that it is imperative that you take what I consider a mini ortho residency, or you're going to some sort of advanced clinical event to learn more about orthodontics and biomechanics and just things you didn't get in school. However, a lot of times my doctors will go to those courses and they'll come back and they're jazzed and they're ready to go. And it's Monday morning and you bring it up in the huddle that we're going to start talking about clear aligners and we're going to do 10 cases. And your entire staff is looking at you like, what the heck did you drink over the weekend? So if we don't have that team training, we don't invest in team training, then again, your program is going to fall pretty flat. So we're going to talk about different verbiage for case acceptance and the workflows of that. And the third here is patient education. So, are we setting the right expectations? Are we looking at and educating our patients the why behind why we might be recommending clear aligner therapy? And are we setting those expectations appropriately all the way through the aligner delivery appointment and beyond of what they can expect? So I really like my teams to hone in on that and have really good need conversations with patients. It's imperative for compliance as well. And then clear financial options. So easy to understand financial options, not this booklet. And I'll tell a story a little bit later, but we're not going to give them too many options. Ortho should be very clear cut, easy. And those options should be in front of them and very easy for them to choose from. And then lastly, we're going to touch on marketing. I'm not a marketing guru, I will tell you that. However, I'm really big on internal marketing and pulling from your current patient base. So we'll talk a little bit about that and some external marketing initiatives as well. All righty. So case selection and identification. So in my experience and what I can see from the numbers and conversions, and when I'm looking at ROIs with practices, when we're diving into the financials and the ROI on some of the different services and products that they're recommending, a clear aligner case in a GP practice should finish in 6 to 9 months. I don't want it going over a year or 2 years. Absolutely not. Those you can keep your relationship with your orthodontist. Those cases need to be referred out. So what are we looking for? What is a 6 to 9 month slam dunk case? And why are we looking for those 6 to 9 months cases? Three things that we're going to look for criteria with our patients. And really, because of these three things, that's why I go back to, I think it's imperative for your dental assistants to know how to identify this. Of course, your hygienist and you as doc. But we're looking for class one, we're looking for like arches, and we're looking to mild to moderate crowding or spacing. When we see this, we know that that's an adult dentition slam dunk case that's going to finish in 6 to 9 months. I'm going to leave this slide up here and talk to it for a minute, just because this is one I think my teams get annoyed with me on, but I like everyone to memorize this. And this is for not only my front office, my clinical team, my doctor, and then of course your financials at the end. But the reason that we're looking for those 6 to 9 month cases is, number one, everyone knows what they're looking for. Number two, everyone can be clinically confident, and this is the type of case that we treat, so that our assistants can talk to this. They know what they're looking for. When you're in the chair and you're recommending clear aligner therapy to a patient, patients are going to ask two things and two things only: how much and how long. If we can all get really good within the practice of saying to the patient, Mrs. Jones, we treat our clear aligner therapy patients in about 6 to 9 months. And I'm just throwing out an example and in terms of price. And it costs about $5,500, but Jim at the front will go over those, what your insurance covers and what your financial options are. But that way we're not getting stuck and tripping up. I do in-office observations before I implement my orthodontic program. And this is one where you've got that patient in the chair where we've fumbled through a clear aligner presentation or recommendation. And when that question comes up, how long and how much, that person, whether it's hygienist or whether it's my assistant, just freezes in front of the patient and they don't know what to say. And then we're pulling people from the front, we're kind of panicking. So if we can get just really good at saying, we in our office, our clear aligner cases finish in 6 to 9 months, and it generally costs about $5,500. Leave it at that, and then we go into the education side of it. So again, super important that that is what we're looking for in order to have a really nice ROI. Team training. So this is one I'll hone in on for a little bit here, because again, I'm a big proponent in team education and team training. And big reason for that is I was part of a team and I saw where it fell through and some of the gaps and where training lacked. And I think it's just imperative that you invest in your team and that they have some knowledge around clear aligner therapy, that they have knowledge around the systems and workflows, how aligners work. I mean, it's ortho one-on-one. When your front desk is getting hit with those questions of their patients calling, I'm feeling a little bit of pain, or how often am I supposed to change out my aligners, or so on and so forth. We want to arm anyone in the office to be able to pick up the phone and answer those easy questions. So it starts here with team training, your patient communication, your systems and your workflows, and then visual aids for patient education. So let's jump into each of those categories in terms of team training. So for my hygienist, I really encourage my hygienists, because a lot of times, right, they're going to push back of, I don't want to sell anything, or I don't want to be seen as salesy. And if we're taking any sort of digital scan, I don't have time to scan. So when I sit with my hygienist and talk about this, I ask them to think of clear aligner therapy from a pre-restorative mindset, meaning that when we're looking to diagnose malocclusion, what conditions are they seeing that might be related to that? What are you seeing that the patient, the teeth aren't fitting properly together? How are we communicating that? What is our solution? If we start thinking of it from a pre-restorative mindset, then wouldn't it be wonderful if those teeth were nice and aligned and had a healthy foundation like a house before we did some of these major restorations? So, I've had a couple of practices where they make clear aligner therapy a non-negotiable for any restorative case. The patient has to go into about a 6-month treatment where they get those teeth nice and aligned before they'll do any major restorations. And their results in terms of preventing less costly dentistry down the line has skyrocketed. So if we can get our hygienists on board with, again, thinking of clear aligner therapy, not just for cosmetics, but from that pre-restorative angle, I think that we can be golden in that and create a lot of case acceptance in our hygiene department. From there, I want my doctor to confirm what my hygienist saw and what she may have brought up to the patient, using what I call the PCS mindset. I'm sure you've heard of it before, but it's the problem, consequence, and solution. So how we want to educate our patients with this is whenever we're delivering any sort of treatment, and again, this is proven time and time again, but to my doctors, don't talk to the patient when they're when they're leaned back and you're talking kind of behind them. I encourage you to always sit the patient up, wheel around, sit with them knee to knee, look them right in the eye. Or if we're looking and talking to a scan of any sort, that we're having that conversation together. So, and pointing out what we're seeing. If you don't, there's simple ways to go about that. If you're not using any sort of scanner or patient education tools or oral cameras, we can certainly still get around that. But I do think if you haven't adopted any sort of digital equipment, we might want to talk about that on a different call. But the problem consequence solution model is I see X, Y, and Z. I see that your teeth aren't fitting together properly. We want them to glide, and yours are colliding. And here's what I'm concerned about. I'm concerned about this because X, Y, and Z can start to happen as the teeth wear down and break down. I recommend clear aligner therapy because. So, thinking about it from that mindset and framing it to your patients, I'm not saying that that patient's going to say yes right then and there, but we've given them all of the information. We've given them some options of what they can do to keep their teeth for a lifetime. For my assistants, I like to train them on reiterating the health benefits of aligned teeth and getting their teeth properly aligned and out of malocclusion corrected. And I encourage them to speak about their own clear aligner experience or ortho experience for that matter and be able to answer those questions with confidence. So if you haven't considered starting out clear aligner therapy, or maybe you're certified but you've only done a couple of cases, definitely consider treating your staff members. They're the perfect people to talk about it. It's great when I have a patient when I'm doing my in-office observations and clear aligner therapy, is being presented, and when a patient has a question and a hygienist or an assistant can say, "Oh, pull my mask down. I'm wearing my liners right now." See, they just pop in and out, and it's just a nice conversation because you're talking about that personal experience that you're going through, and the patient can resonate with that. And then for my front office teams, really knowing the patient benefits prior to the appointment. We should have that ortho breakdown, know the lifetime maximum. That should be just a easy breezy and very clearly stated somewhere within a chart note before that appointment. Because the last thing we want to do is we bring it up and then we have no idea how much coverage is, and then we're running to the front and somebody's got to check it while the phones are ringing, and it just gets really clunky. And the last thing we want is for that patient to walk out without some sort of financial presentation being had. And then for my front office as well, I want them to be excited about treatment if this patient decides that they're going to go through it. I want them to reinforce the benefits of clear aligner therapy and again be able to talk to any sort of their own personal experience that they may have had in clear aligners or ortho in general. All right, so patient education. So visuals, again, I'm going to talk a lot about if you don't have a scanner, you're kind of behind the times, might want to consider one, simply because when we are putting a scan of a patient's teeth up in front of them, and this goes for clear aligner therapy or anything that you're trying to treat, night guard, a restorative procedure. I'll use my personal experience here in just a minute, but we want them to be able to be looking at what we're talking to, what we're seeing, because when it's right in front of them, it's a lot harder for them to push back on you or deny you or push you off another 6 months. They're going to be more apt to do something and to convert to any sort of treatment you might be recommending. I always say that if I took my car in, for example, and mechanic said, "Oh, Nicole, you could use some new brakes, your brake pads are wearing, so on and so forth." Okay, I know it's going to be expensive. I'm likely going to push them off and say, "Yeah, no, maybe next time, but I'm okay right now." Um, Now, if they pulled up a 3D image of my car and I could see where I had wear or my brake pads were about to give out, I've got twin toddlers I'm driving around constantly. So I'm going to be more apt to do something about it versus just pushing off and waiting. So when we're utilizing digital tools, it really is the name of the game. We want to show the patient their teeth because, of course, seeing is believing. The verbiage I like to use when I'm pulling up a scan is let's take a tour of your mouth together, and then we just revisit that problem, consequence, solution verbiage. I see, I'm concerned, I recommend. If we can really get good at that framework, you'll see case acceptance really for anything that you're recommending have an uptick. And then again, I'm really big on sitting knee to knee with your patient when we're recommending any sort of treatment. Take the time to answer questions and address their concerns. I'm not saying, of course, for my doctors to get stuck in the chair for any longer than they need to, but also identifying, and the third point here, when we pass the patient to the next team member, I call this we're passing the power. We want to pass that power and empower each of our team members, right? As we're going through this patient journey and this patient flow throughout the office. So again, that's just an example of passing the power from hygienist to doctor to treatment coordinator to assistant, and identifying when those key words are that we might be, okay, I think like doctor has had his time, his or her, and it's time to pass back to hygienist to reiterate some things, and then obviously on to a treatment coordinator or our front office person who will be presenting financial treatment. So if we can identify a system and get really good at this and practice it, it just makes the fluidity of that patient appointment just go so much better. And to be honest, it makes us look really good. It makes us look like we're on the same page. It makes us look unified, and I think that that's absolutely huge. But one story I want to share with you in terms of, I always say that if you're in the dental field, you're the worst you're the worst patient. And so my dentist, very well known dentist in Seattle, and she took a scan of my teeth about a year ago and puts it up on the screen and says, Nicole, your lower anterior recession is getting pretty bad. We might want to consider an appointment with the periodontist. And I pushed it off for probably 2 years. And just this last year in 2024, she said, let's get another scan of your teeth. I want to see the changes that have happened, because I can tell you, but I want you to see it visually. And I knew, of course, I've scanned myself, and I knew how bad my recession was getting and becoming. And I was floored at how much change I had had year over year, and left that appointment, made an appointment with my periodontist, and ultimately had my graft done earlier this year. So again, it's that seeing is believing. We, of course, are now in a society where everything is in front of our face, and we have a visual image, right? I always say that, of course, these are like it's a computer. It's now a computer in front of you at all times. So I think that if we can speak to any sort of image, whether again that's with a digital scan, an intraoral photo, just something that we can be talking to that patient and have them visually look at it, I think it's just going to again help you with case conversion. All right. Jumping in, a little bit of a controversial topic here, but this is what I recommend. So, setting clear financial options and having those readily available. Um, I'll tell you another story. So, I had a doctor that I worked with for, oh, gosh, 5 years. And when I initially went in and we were helping with her ortho program, I did it in office observations. Typically, how I start, I go in for half day and just listen and take notes, and then it helps me coach to what's going on. But when it came time for the financial presentation, didn't get a treatment coordinator pulled up to into the op, and it wasn't an assistant, wasn't a hygienist. Doctor said, I'll be right back. And doctor came back with about a 10-page laminated binder of all the different payment options she was offering to that patient, handed them a dry erase marker, and said, circle which one you'd like. And I thought it was a joke. It absolutely wasn't. That was how she did it. And this was just for clear aligners. And so that was, of course, where we started. Number one, we got to get this down to a one pager, 3 options. So I'm really big on making it clear and concise. So what we know, and this goes back, there's a ton of research done on this, but we know that patients want one of 2 things. I mean, as consumers, we want one of 2 things, and it's typically going to be a low down payment or a low monthly payment. So when we're giving a treatment presentation, I want you to keep that in mind, or when you're maybe reevaluating what your treatment options are within your practice, consider these 3 options. So the first is a payment in full, and we would offer a 3 to 5% discount for that payment in full. Option 2, again, I put a wide range here because it is a pretty controversial topic, but I recommend as low as $300 down to start treatment to upwards of $1,000. Again, just as an example, some doctors like to recoup their entire lab fee, and I understand why. However, if we're doing any sort of in-office down payment, then we want those 6 monthly payments and balance to be collected fully prior to that patient getting their retainer delivery appointment. Our third option, of course, is third-party financing. I highly recommend Cherry or HFD, but if you've got some sort of third party within the practice, great. I always just say you need to have it as an option. Now, when we're quoting a patient, I want you to go back and look at your payment option forms for clear aligners. With this, we want to list out all the things that their ortho or clear aligner therapy is going to include throughout their journey. I think it's really confusing when we give a patient a treatment quote and all we have is codes attached to it, the insurance codes. Patients don't know what that means. And then you're going to have some who get into the weeds of, well, am I being charged this amount for this and then build this for this, so on and so forth. So we want to avoid that. So I like to list out everything that includes, hitting home on their, of course, their comprehensive exam, their photographs, a scan if we're taking their photographs. We're going to do includes any of their aligners, of course, all of their visits, their retainers, and maybe some whitening at the end if you choose to do so. But just so it feels like that sticker shock of for that price that we're putting on it feels like they're getting a lot out of their treatment. I'm a big fan of wrapping those retainers in as well, just so that it's easy. Patient can see it. There's no surprises at the end because oftentimes they'll go through treatment and completely forget at the end that they've got to pay for retainers next. So I think collecting it up front is the best way you can go about that. Of course, then we're going to reflect any insurance that the patient might have, what their investment is, and then whether we're choosing a flexible payment option with third party or payment in full, or again, an office payment plan, depending on what you're comfortable with. And then be sure the patient leaves with a copy of the treatment fee quote. I've also seen where it's presented and then it's shredded and the patient never leaves with a physical copy. It's imperative they leave with it. And if you can, print those photos out, print a scan report out if you can. We can go over if you're interested. There's a way to print scans out and take screenshots and annotate and different things. So but it's imperative that they're leaving with some sort of visual, because I can tell you as a busy mom, if I don't have a visual in front of me, probably never going to get around to it until I'm bugged to death and there are 10 phone calls and 5 voicemails later. But I always say that when you leave with a folder and something physical in your hand, then it might get tossed on my desk, but eventually I'm going to get back around to it. Or if the classic is I got to go home and talk to my husband about treatment or go talk to my wife about treatment. But if you can bring them something to show and that you've had that good need and need conversation, and now you're printing out and giving them something physical to take home to talk to that spouse with, they can have a more educated conversation as well. And we can talk to, I help with overcoming objections, because of course you're going to get those objections, and what's a healthy way to overcome those objections to where we're not hounding the patient, but again, we're offering a solution to help ease the minds and again, answer any of those questions that are burning. All right. So marketing, building awareness and promoting internally. I cannot tell you how many times I have heard in an office when I'm doing my observations, "Oh, I didn't know you offered clear aligners." Please, please, please don't be don't be that guy or gal. The reason being, we should have some form of marketing material. If it's not been brought up, if there's no marketing material, if it's not on our websites, then we're missing a piece to the puzzle. Oftentimes for adult patients, they were probably told, let's just say, for example, 10 years ago when aligners were new, 15 years ago when aligners were relatively new, it was likely that an adult with minor relapse probably wasn't a candidate for clear aligner therapy. But as we know, things have evolved and changed. And so if they were told no in the past, that may have just stuck, and they just think that ultimately they're never going to be a good candidate for clear aligner. So I want you to be talking about it and promoting it internally. And again, it's not that it needs to be this blaring, flashing thing, but if you're not offering clear aligners, make it a fun rollout. Make it, now offering, happy and excited to announce that we're bringing clear aligners to you, and being able to offer clear aligner therapy in office with whitening, things like that. So again, making sure that we're promoting and building awareness internally. The other thing with promoting internally is, you don't need to have this big external marketing effort. You really can start within the practice. Again, if there's probably a ton of patients you've never brought this up with, or again, they don't know. So look at that. Look at those patients who would benefit from clear aligner therapy, and come up with a talk track or identification of how we're going to talk to those patients. And then we're going to use a marketing channel. So, of course, social media, your website, and in-office materials such as brochures and any sort of videos. I always like to say, find a media mogul in the office and assign a content calendar. So pick somebody in the practice that might be interested in marketing, an assistant who wants some expanded duties, and offer that chance to them. A lot of times, we don't have to spend a ton of money going and doing these big marketing efforts. We really can control it within the practice. But what that takes, and I found that's most successful and something that we help with, is again, you find that marketing mogul within the office, and we do have some sort of content calendar so they know what they're posting each day and what channels they're posting to and what content they're posting. I also recommend getting the entire team involved, having your team write some articles, do a patient appreciation post, a patient spotlight, or before and afters. Consumers and potential patients love to see that, but it also is a way to get everyone in the practice really involved. And it goes back to, again, where we want to create this really cohesive, strong team unit. And if we had a hygienist who had a great experience with someone who went through clear aligner therapy, and that patient is talking about it and they're excited, we want hygienists to be able to highlight that patient and that experience that they had along that smile journey. And then building a brand, so showcasing those success stories, asking for reviews, and implementing a referral program. Huge. All things you can do within the practice. You, again, don't have to spend oodles on external marketing. This truly can be done in office. Asking for reviews. So this comes up a lot, especially with, again, any procedure, but doing clear aligners. I mean, at the end of treatment, it's 9 times out of 10 you're going to have a really happy patient who you've changed their smile, you've instilled confidence, you've changed their life. Again, I go back to my fairy tale. I mean, if I still couldn't close my lips over my teeth, I'd be it'd be pretty traumatic. And so I think that when we have a patient who's super happy at the end of treatment, that's the time to ask them for a review, is right then and there when we're getting their retainers, their new smiles being revealed, they're super excited, they're just smiling ear to ear. Just it's a simple talk track of, Jim, I'm so excited that you finished treatment in our office. Your smile looks fantastic. It would really mean a lot to me and to the team if you wouldn't mind taking a few minutes to leave us a review. That patient's not going to say no, or I'll do it when I get home. They're going to do it for you right then and there. So I think that we miss that mark a lot in the office. And again, take clear aligner therapy out of it. I think you should be doing this for any of your patients that you're finishing a major restorative case, or just anything that you key in on that they're really happy with within your practice. We want to talk about that. And then we want to track it. So I cannot stress enough the importance of tracking marketing efforts. Come up with a system. Systems are huge. If we don't have a system for each of these things that we've talked about, then we're never going to have that full pull through. So we want to make it a standard that at the front desk, we're asking where those new patient referrals are coming from, and have your clinical team confirm when they get brought back. So when they check in, and Jim, it's so nice to see you. I just want to confirm, how did you hear about our practice? Oh, on your website. Great. And then mark it in the chart. Have your clinical team confirm it as well, because then if we're getting into a friends and family situation, we wanna be excited and reward that as well. So again, having this is a system around this, and what I like to call an SOP. So standing operating procedures for each of these things, and creating really an in-office manual to create a consistent program. All right. So some key takeaways I want to touch on are: implementing clear aligners into the practice can enhance patient care and expand your service offerings. So the three things that I strongly and highly recommend that we invest in are comprehensive training for all team members. I can't tell you, if you're not investing in your team, you're not going to accelerate your growth. It's imperative that you invest in your team trainings, your team's education, your team's confidence, vision. Your team should be consistently exuding your vision for the practice. And if we're doing all of those things, then ultimately it is going to accelerate your growth. And are we streamlining patient workflows? So are we educating? Are we scheduling properly? And are we treatment planning effectively? And then effective marketing, again, both internally and externally. If we do all of these three things, then we really can create a successful and consistent clear aligner program that meets patient needs and drives practice growth. The goal for me when I'm in practices and when we are implementing an orthodontic program is I don't want to see those peaks and valleys. I want to see consistency. So I don't think it's realistic to come in and expect you to do 50 cases. I want you to, and that's great. And your bank account would love it. But again, I think if we're not creating consistency, then when we do have those peaks and valleys, it's just we don't get that full pull through from our staff members, from our we don't get buy-in from our team. We're not we just look like a little bit, I guess, in cahoots and chaotic when we don't have things streamlined. So again, I think that if you can take, I'm going to go actually back a couple slides here. But if we get good at, again, case selection identification with everyone in the practice. And so how do we do this? We're going to pull up certain cases. We're going to look at some ortho photos and decide if they're a good candidate or not for treatment. And then we're going to learn how to talk to that with team training and verbiage to case acceptance. So again, I want to empower my entire team, not just one person or not just one department. We want to be empowering everyone from the front office to my assistants, hygienist, and my doctor as well. And then patient education and setting the right expectations. So going back to that, when we're having those need conversations, we need to have a very clear system of what we're communicating to the patient. We're going to talk about compliance. We're going to talk about everything from here's how you clean the aligner. You might need a couple of what the aligner world calls a refinement. Patient's not going to know what that means. So a lot of times I'll say, we'll get about halfway through treatment, and sometimes teeth have a mind of their own and they've shifted a little bit in a way that we didn't quite expect. It's not a problem. We just need to take I won't say a pause, but we just need to take another look, an additional look. It's like another short little exam, reset some things and get you some new aligners so that everything finishes out properly and you've got the smile that you ultimately want at the end. So but again, it's going to go back to talking about those things on the front end, during, and then post. So do we have a clear system? Do we have what I call patient contracts, not a financial contract? But when we are communicating to our patient and sending them home with a clear aligner case, are we sitting knee to knee with them, going over the care instructions, going over the wear instructions? At the retainer delivery, are we going over that retention is for life now? And we know that if retention is not for life, then those teeth will shift, will have relapse, and we'll ultimately have an unhappy patient. And then do we have clear financial options? Are they easy to understand? Could anyone in the office pull a clear aligner quote and present it to a patient with confidence? It again should be those three options. They should be clear, defined, and presented to the patient. And ultimately, we want to close that same day if possible. And then our marketing efforts with internal and external marketing. Again, I always start with internal. What can we do in terms of creating a content calendar? How are we asking for reviews? Are we asking for reviews? Do we have someone that's interested in the practice that can go over and be again dubbed our marketing guru? So I think that is imperative. So again, if we do these 5 things and we get really good at them and we create a nice workflow and system around it, I can promise you that your case conversion will absolutely skyrocket. So with that, so how Next Level can help you. So we have a comprehensive, it's a 6-month ortho program. So what we do is we come in and we'll do that practice opportunity assessment, or that observation where we're in person. I'm walking around the practice, I'm listening, hoping you have some new patient exams or even some ortho exams that day. And if we don't, and if we're just starting out, then we look at your patient pool, we look at demographics, and come up with a personalized treatment plan, if you will, for the practice for the next 6 months. So it's a mix of in-person and on-demand team training. Again, really big on the team training aspect. So I like to tackle each department within the practice one at a time, and then we bring it all together at the end to really make it a nice workflow, which we do practice and role play, which nobody likes, but you got to get the marbles out. Verbiage and case acceptance training. I go over this. This is not just for my hygienist and my assistants in my front office. This is also for docs as well. So I like everyone to be a part of that workshop, as it's just imperative to know and to hear what everyone's saying. And then how to bill insurance for ortho. So we talk about that, talk about how to bill for a digital scan, just streamlining that process and utilizing a really good ortho benefit insurance verification form as well. That's easy for anyone to understand. And then marketing clear aligners, again, coming up with that content calendar and that you can rinse and repeat from month to month, but knowing what to post, when to post, how to post, And really, if it should be a before and after, it should be a client spotlight, so on and so forth. So we get a nice little calendar set for you. And then utilizing digital and visual tools for case acceptance. So what are we currently doing, and how has it been going? What needs to be improved? Do we need to invest in some sort of digital tool? And how to go about that. And then post program, you get ongoing support. So one of the things that sets us apart is that we're a team meeting your team. So not only do you have me, I'm an executive practice management coach and our ortho specialist, but we have a team. I have Michael and Paula, who are the partners listed up here. Michael does more leadership coaching, and Paula is is a hygienist, former practice owner, and is our clinical director. So if there's hygienists that need a little extra love on how to incorporate clear aligner therapy, Paula can be brought in and goes over that. We've got a great billing and front office coach. So we really are a team supporting your team, which is great, because it's, again, a team coming behind your team and just elevating all of you to succeed. So thank you. That is all that I have for you today. And again, I appreciate the time. I think we're going to open it up for some questions, and we'll let you get back on with your day.
Yes, thank you, Nicole, for presenting to
Yeah,
our members
absolutely.
and guests. Pleasure having you. And now is a great opportunity for anyone to post their questions in the Q&A. Looks like we have two. The first was, what's the one barrier teams struggle with the most when diagnosing ortho in a GP office?
Yeah, I think it's just, again, it comes down to having the competence to look in a mouth and diagnose it. And it's not that you're diagnosing it, you're bringing something up that you notice. I'm not saying that an assistant or a hygienist should be able to look in the mouth and say, you're class 2, you have mild to moderate upper lower crowding or spacing. Not what I'm looking for. I'm looking for them to look in the mouth and recognize those things, but come up with a conversation more around how have you had ortho before? Have you had any ortho treatment? Are you currently utilizing a retainer? Simple as that. No, yes. Then we dive into, well, did you know, if you're not wearing a retainer, retainers are for life. Does look like you have had some ortho treatment, or if they've shared that with you, looks like you've had some relapse. That's something we can definitely help you with if you're interested. And I do recommend it, because I might see, again, problem consequence solution, and having your doctor confirm that. So I'm not necessarily looking for my teams to diagnose. I'm looking for them to recognize what we're looking for would be a good candidate for ortho. Because again, a lot of times you're not going to capture that patient on the first visit. It's going to be, the next one after that. And there's also a way to finesse bringing up in a very constructive way, bringing up clear aligner therapy in those preceding appointments if we don't get a what we call a same day close or a same day conversion.
And there was one question about recording. We have recorded this webinar today, so we will be sharing that with you probably later on this week. Here's another one. What's the best way to treatment plan financial arrangements in a GP office?
So I'm just going to read it to here. What is the best way to treatment plan financial arrangements in a GP office? Yeah. So a lot of times what we'll do is, again, you're going to have kind of a blanket quote that your treatment coordinator, your financial coordinator, whoever it may be, is just going to have on our desktop. We're going to fill it in pre that appointment with their insurance benefits. But then I always, if you're going to be doing any sort of in-office payment plan, we'll coach you on how to set up a separate ledger, so that when we are billing, it doesn't totally mess up your ARs. Of course, ortho will, just in general, it's just a rule of thumb. It's just always going to make your ARs a little bit wonky. But we always recommend setting up a different ledger or ghost ledger, so that when you are posting those insurance payments or those payments that you're getting throughout treatment, it's just not affecting it as much. So and then again, when we're looking at treatment, so we want to go back to knowing that we only treat cases that are going to fall within that 6 to 9 months, and we have one comprehensive fee, so that we're not having multiple fees that we have to worry about treatment planning, because I think that you can get into the weeds with that as well. So I really am a big fan of just having one fee, and being able to communicate that to the patient. Again, anyone being able to grab it and present it to anyone in the practice. And let's see, Jim, there was one here. I think I'm just going to take this one because it was in the chat. How much do you recommend a charge for a scan? So I don't recommend charging the patient for a scan. It's part of the orthodontic complementary ortho exam. A lot of GPs do not charge for an ortho exam and they don't charge for a scan. However, you can bill out to insurance for it. So there's an insurance code. And Jim, I actually can give you these resources. We can send out, post this as well, and it'll walk you through that. A lot of times you're going to get paid zero. The most I've seen it reimbursed on a scan is about $40, and you can only do it about once a year. But again, it is a good way to recoup a little bit of some fee there. But why we don't charge for a scan is that we want to have that digital record of our patient. It should be a service that we're offering to them. And if you've got good scanners or scanners that need some coaching, we want to ultimately get their scan times down to about under 5 minutes, regardless of what scanner you're using. There's ways to do that, and usually it's just some technique and lack of education. So, but yeah, I do not recommend charging for records on the front end, and I don't recommend charging for a scan. I recommend that all being wrapped into one, because again, you can hopefully use that scan for, again, restorative, maybe a night guard, things like that. So we're not just using it for ortho.
Who's the best partner, Invisalign, Candid, etc., a GP can align themselves with?
Depends on what you're looking to treat. So, what kind of types of cases are you looking to treat? How clinically confident are you? Invisalign, you're going to be investing in yourself quite a bit. How clinically into the weeds, and do you want to get, how much time do you have to learn 3D controls in the software? With Candid, what's awesome is that, again, I think it's great if you're starting out and utilizing Candid as a partner. Couple of things. Number one, they have dental monitoring, which is great. So that's where the patient is, you can monitor them virtually. But second of all, it's orthodontist back. So orthodontists are actually setting up your ClinCheck and setting up your case. So you've got that clinical competence of that orthodontist being behind you. Whereas in Invisalign, that's not necessarily the case. A lot of the treatment planning is going to fall on the doctor. And so again, if you're not really clinically confident, you're going to struggle. So I would say if you're just starting out, or if you're like, hey, I don't want to have to think about this, I don't want to go home and have to do 20 ClinChecks and set up cases, then I think Candid is a great partner. And we can talk offline about it, but we have a great partnership with Candid with some pretty competitive pricing too through Next Level. So great question.
Thank you. What are your recommendations for patients that are behind on their payments and are nearing the end of their treatment?
Awesome question. So typically cases stay open for about 3 to 5 years, and that's regardless of whatever clear aligner that you're using. We used to, which was really effective, because that case stayed open for 3 to 5 years, we would just have a really honest conversation with the patient. So one of two things. You can see what they can afford, which I know, again, you're eating some of that, but come up with a financial arrangement that works for them. We don't want to lose a patient over this, and we don't want the patient to, again, just go away and never come back, especially if they've been an established patient. So I think that if we feel comfortable having an honest conversation and making a financial arrangement with them, great. However, if not, we would do what we would call an ortho break, and we'd pause treatment. So we just end treatment where they were. We'd get them a set of retainers, just an Essex. We'd make it in the office. Your lab would charge a pretty low fee for that too. You would charge the patient for that retainer. Let them know their case will stay open for those 3 to 5 years, but we're going to go ahead and pause treatment for now. And then again, most of those patients actually would start treatment back up, especially if, again, feel your patients out. We're all human. If they are a patient who had a medical issue come up and they can't be in treatment, help to just walk through and understand exactly what's going on behind the scenes with them. So I'm a big proponent on that. But ultimately we're going to get burned by patients. It just is the way that it is. And don't let that scare you. Just unfortunately, if it's one that's never going to come back, you're not going to recoup that payment, then we're looking at a collections issue at that point. So
We have another question. It's about your services and
yeah,
program, and it's more specific than we should answer here. If you could maybe bring up your slides or contact information again, Nicole, and we could also
yeah,
share that with all attendees after the meeting as well. We'll send out an
sure.
email.
Yeah, let me put it back up
But
here.
we still have time for a few other questions if there
Yep,
are any.
go ahead. I'm just going to go to the end there. Can you go ahead and see it? Jim, can you see my contact info? Is it up
Yes,
there now?
it's
Okay, cool.
there.
Great.
Any other questions for Nicole? Okay, well, thank you again, Nicole, for being with us and presenting. And thank you to all of our members and guests for joining us. We will send you a link to the recording later this week. If you have any further questions, please reach out to us. Enjoy the rest of your day.
Thank you. And thank you, everyone. It was a pleasure to be here. Thanks, Jim.